Hi, I'm just getting set up here. Welcome, everybody. Happy holidays. I'm very excited to deliver Medicare Made Simple to you. Thank you so much for taking the time. We'll just be getting underway in a few moments. Just a couple more minutes here. Welcome, welcome. Thank you so much for coming in. My wife and our puppies are in attendance too. We have a 5-month-old puppy that we're trying to train, but she's having a little difficulty making it outside all the time. Sometimes she has an accident in the house, but she's in attendance. Come on in. I am so excited to deliver this presentation to you. Please, there will be an opportunity to address your questions as we go along. So if you could just say hi in the chat, I would love to take your questions at the end. And also, I will go back over and see whatever I might have missed while I'm delivering the presentation to you. So just another minute here. I have the time as 12:28 because I'm located in Phoenix. My wife and I just moved here from Chicago. We are loving it so far. Big weather difference for us. I don't know if anyone is a snowbird and they spend time perhaps in Florida or in Arizona, but if you're in Arizona, I would love to say hi and I'd love to hear from you. So if you're from Arizona, please drop that in the chat. I love making friends here. We just moved. So just another minute till we get underway. We'll wait until 12:30 on the dot to begin. Come on in. You are definitely on time. If you are just joining now, the presentation has not started yet. So on your screen, it should just say Medicare Made Simple. All right, we're going to get underway here. Hi, everyone. My name is Ari Parker. I've dedicated my career to helping people make better choices around Medicare. I'm the lead advisor at an organization called Chapter, which has the same mission that I do. We help thousands of seniors every year free of charge. There's no cost to you for working with us. And ultimately, from today's presentation, I just want to make sure that you're empowered with the knowledge you need to sort through your Medicare options. That's really our goal in hosting this presentation. And so I want to address your questions. We'll have plenty of time at the end. And you can also, if you don't feel comfortable putting your question in the chat, you can follow up with me after the presentation. My email is listed, and also you can reach me directly at 605-205-8869. The reason I give these presentations is that I find that you can learn a lot in 30 minutes. That's really a discovery that my team and I have come across from giving these presentations. And I think you'll be able to use today's knowledge to pick a plan that's right for you and maybe even save some money along the way. And this isn't just for seniors who are eligible for the first time. The steps that I'm going to outline are really important to keep in mind because the plans change every year. And I'll come back to that along the way. That'll be a theme that runs through the presentation, is that the options change every single year, and they're certainly changing looking ahead to January. So the purpose of this presentation is educational. You'll have questions along the way. Drop them in the comments, and this way we can go into a lot more detail together. For today's agenda, there are 3 things that I'll address. The first is I'm going to introduce you to a fusion of 2 types of clients from your community that we've helped, Ronald and Linda. we're going to talk through the 3 critical decision phases that they needed to go through as they chose Medicare coverage and that we helped them with. Then I'm going to cover the 5 most common mistakes that I've seen clients make, and I wanted to share them with you so that you can avoid them too. And just give me a moment here to have a sip of water. Okay. I'm seeing that we're having an issue with the screen share. So let me share my screen. Sorry for that. All right. We should be sharing the presentation now. So let me just recap it if you missed it. So as I mentioned, you can follow up with me after the chat, and I want you to after the presentation, and you can type your questions in the chat. Just drop them in the comments, and I also want to hear from you. So please follow up with me. Again, my number is 605-205-8869, and I just want to confirm that the screen is sharing, that the screen share is live. So give me a moment to confirm that. I'm just messaging people who are viewing outside of the control room. All right, I'm going to stop the presentation for a moment and make sure that screen sharing is on. Okay, I have screen sharing on. I've stopped the share and I've restarted it, and I hope that this solves the problem because I definitely want you to see the presentation as I go along. I'm just waiting to see in the comments whether everyone can see the presentation. I'm just moving slide to slide to make sure that it appears on your screen as well. Okay. If you have any questions, I'm going to take those while we work to get the screen share up and running. I'm sorry about that. It's appearing on my screen, but I know it's not visible to people who are jumping in. So hi, Lucinda. I see that you're able to see the screen share. It appears. Could anyone else who's in the room right now tell me if they're able to see the screen share as well? I just paused it, but I can resume it. I want to make sure that you have the whole presentation in front of you because I think it's going to really help you follow along as we move through. Okay. So I'm going to do a new share and hope that that gets across. Okay, so I just restarted and I'm hoping that this comes across. All right. So I'm going to restart Zoom and hope that that solves the problem. So give me a moment to restart. All right. I just restarted the Zoom And I hope that now everyone can see the presentation. I know that we're now 7 minutes over where we'd hope to begin, and I'm really sorry about the delay. This technical difficulty is totally on me. It's not on you, but I'm still planning to, I still think that we will finish well ahead of the 3:30 stop point. So if you have somewhere that you need to be at 3:30, I'll be mindful of that and try to finish the presentation as if we hadn't been delayed. I'm sharing my screen again. All right, so I'm just going to go ahead, and I hope that what I'm seeing and what we've prepared for you, that you're able to see. I'm just going to get underway though. So I want you to meet Ronald and Linda. They're neighbors that we've helped in your community. And I think you're going to find that even though there are a fusion of clients that we've helped, that the decision phases that we walked Ronald and Linda through will also apply to you as you choose Medicare coverage. So here are the steps that we took Ronald and Linda on. The first is that we signed them up for traditional Medicare. We helped them sign up. The second is that Ronald and Linda then needed to consider additional coverage. The reason they needed to consider additional coverage is because Medicare doesn't cover all of the costs or all of the care that you need. Third, once Ronald and Linda decided what type of additional coverage they needed, and there are two types, and we'll get to that later, then the question is which plan, because there are dozens of plans, and we see this no matter where you live across the United States, that you just have a ton of options, sometimes well over 50. But don't worry, I'm going to walk you through each of these stages so that you understand them and feel confident about starting your Medicare. So step one, signing up for traditional Medicare. That's where the process begins. There are two parts to traditional Medicare. Hospital insurance, which is Part A, and this covers inpatient care when you're in the hospital, care in a skilled nursing facility, and home health care. Then there's Part B, which is medical insurance. This typically covers medically necessary services like those you see in a doctor's office. It also covers preventative services like flu shots and certain disease screenings. Next is the question of how each of these is paid for. Well, Part A is usually fully prepaid. If you've paid Medicare payroll taxes for at least 40 quarters, which is 10 years, then you've likely already paid up for your Part A. So there's no reason not to start it because you won't owe a premium for it, unlike Part B. Part B is where it gets interesting. In Part B, many people don't know that you actually have to pay your premiums. It's paid to the government, and it's not covered 100% through your taxes. Instead, if you haven't started your Social Security yet, you're going to receive a bill from Medicare, and these Part B premiums are going to be owed to the government. And if you have started your Social Security, then the Part B premium is going to be deducted from your Social Security check. How did this apply to Ronald and Linda? Well, they both signed up for Part A because they'd already prepaid their premiums. So there was no reason to wait. They'd already paid through taxes during their working years. So they both started drawing on their Part A benefits. What about Part B? Well, Part B is where it gets interesting. Ronald's case is straightforward. He retired at age 63, so he was ready to start using Medicare as soon as he aged in. We typically advise clients like Ronald who are 65 and ready to start their Medicare to sign up for Part B as soon as they're eligible. There's no reason to start waiting to enjoy the benefits of their Medicare. What about Linda, though? Linda chose to wait. She's still working. Why would Linda choose to wait? Well, the reason Linda decided to delay starting her Part B is because she already had employer-provided coverage. So there's no reason for her to pay two premiums, one for her work health coverage and one for her Medicare coverage. That would just be redundant. So instead, we advised, and we typically advise clients like Linda to wait to start their Part B until they're ready to retire. And Linda won't owe a penalty, but we'll get to that later as a result of her decision to wait. Now, I want to be very specific about when you can sign up for Medicare. First, let's talk about people like Ronald who are signing up by virtue of turning 65. When can someone like Ronald sign up for Part A and Part B? Well, clients turning 65 have a 7-month period called the initial enrollment period. The window starts 3 months before their 65th birthday, and it extends 3 months after the month in which their birthday takes place. So, to reiterate, this is a 7-month window. How did this apply to Ronald? Well, Ronald's birthday was January 2nd, and it's coming up. He actually decided to enroll earlier than his birthday so that his Part A and Part B would start January 1st. So the earliest that Ronald could sign up with a birthday of January 2nd is actually October 1st. Indeed, Ronald decided to sign up, I believe, sometime in November, so still early. And that way, it guarantees that his benefits will start January 1, which is the earliest that they could possibly start. Your benefits start in the month in which you turn 65. Now, what's the latest that Ronald could have decided to sign up had he procrastinated? That would be April 30th. That would be the end of Ronald's 7-month initial enrollment period. So this is Ronald using his initial enrollment period to sign up for traditional Medicare. What about people like Linda? Well, Linda's already 67, so she's not eligible for the age-in window, for the just turned 65 window that Ronald used. How is Linda going to sign up for Medicare when she leaves her work health plan? Well, Linda's going to have a special enrollment period. And because Linda will be losing her group health coverage and her employer has more than 20 employees, this means that Linda's going to have an 8-month special enrollment period to sign up for Medicare. And this window begins after Linda loses her work health coverage. And what this entitles Linda to do is to sign up for any plan that she would like. However, Linda might be benefited by signing up earlier than the 8-month window because there are other considerations that might be important to clients like Linda. And when that's the case, we typically advise them to let us know months in advance of their retirement so there won't be any gap in their coverage between their work health coverage ending and the start of their Medicare Part B benefits. So though clients like Linda officially have 8 months, there are other considerations. Like, for example, if Linda wanted a standalone prescription drug plan, then she actually needs to act within 63 days of leaving her creditable coverage in order to avoid a late enrollment penalty, which I'll cover in a bit. So what I can't stress enough is that while you officially have 8 months, you really should think about reaching out to an advisor as soon as you're thinking about retirement so you know what type of Medicare coverage, what type of additional coverage you'll want to purchase when you retire. That way, there won't be any gap in your coverage between the end of your work healthcare and the start of your Medicare Part B. All right. So I've been touching on this. What do I mean when I say Medicare Supplement or Medicare Advantage? Well, what I mean is that traditional Medicare doesn't cover at least 20% of your medical costs. In fact, it only covers 80% of your medical costs. And even those costs are only partially covered. Then there's a whole host of costs that traditional Medicare doesn't cover at all, not even partially. Things like drug coverage, and I'll talk about drug plans in a moment. Things like vision, dental, and hearing. So when people realize that there's this whole category of costs that traditional Medicare doesn't cover, it's really the number one thing that motivates people to think about purchasing additional coverage. That's typically when we meet people because they realize that there are all these things that they thought Medicare was going to cover that it actually doesn't. So that's why I want you to be aware that Medicare only is going to cover 80% of your medical costs. There are going to be gaps in your coverage if you just are depending on original Medicare. And I don't want you left holding a big 5-figure bill that you thought Medicare was going to be that you thought Medicare was going to take care of for you, when actually it's not going to. That's when we meet clients. So this brings us to stage 2 of our Medicare journey, which is considering additional coverage. All right, this is the most tedious slide of the presentation, but the reason I put it here for you is that I want to break down the differences between Medigap and Medicare Advantage plans. Medigap sits on top of traditional Medicare, which means it actually provides you with more choice, because you can see any doctor who accepts Medicare as long as they're also taking new patients. It also covers the 20% you'd otherwise have to pay under original Medicare. So that's why it's called Medigap. It covers the gap between the 80% and the 20% you would otherwise owe out of pocket. And finally, I know this might seem redundant, but it still sits on top of your original Medicare, which is a difference from Medicare Advantage. Medicare Advantage, which is sometimes referred to as Part C, is different. Instead, it's a substitute entirely for original Medicare. It's offered through private insurers, but they have to offer the same services that you would otherwise obtain through original Medicare. And then it often includes additional benefits, unlike Medicare supplement plans, things like prescriptions, vision, hearing, sometimes even dental. And indeed, gym memberships and chiropractic perks are not unheard of when speaking about Medicare Advantage. So if those types of supplemental benefits are important to you, then typically we're talking about Medicare Advantage plans. So now I want to discuss what type of coverage Ronald chose. Well, Ronald's goal was to minimize premium payments. Remember that Ronald is on a fixed income. He's mostly reliant on Social Security. So keeping his premium costs down, besides for his Part B premium, which is billed by Medicare and that there's nothing we can do about, was very important to Ronald. So what type of plan did Ronald choose? Well, Ronald chose a Medicare Advantage plan. And there are 4 things that you should know about Medicare Advantage plans. The first is that there are low premiums. It's typically inexpensive, and some even offer $0 premiums because the government is helping to subsidize it, since if you enroll in Medicare Advantage, it's being privately administered through private insurance companies. The second thing is that many of these plans include some type of prescription drug coverage, whereas if you don't go the Medicare Advantage route, we typically advise clients to consider standalone prescription drug coverage. That way, their prescriptions will be covered. With a Medicare Advantage plan, the prescription benefit is usually included, even with the $0 monthly premium plans. The third thing to know about a Medicare Advantage plan is that they typically have a defined network of providers, which means that the carriers, in exchange for offering a lower premium, constrain your choice of doctors so that the plans can be priced more affordably. There are network limitations with Medicare Advantage plans. And then finally, there are additional benefits that these plans include, like dental, hearing, vision, and indeed, many of them have free gym memberships attached, and even over-the-counter benefits that you can use at the drugstore. So for many people, these things look really good. Ronald loved it, and we find that many of our clients who list price as the most important factor tend to be drawn to Advantage plans. But here's the thing. You can't have both a Medicare Advantage and a Medigap plan. You need to choose one or the other. So if cost is the most important, then you're typically looking at a Medicare Advantage plan. However, you need to weigh that against other factors that might be important to you. For example, choice of doctor, because you might find that all the doctors that you'd been seeing previously won't be in network with any Medicare Advantage plan as a whole that you could choose. So you might find that sometimes it's necessary to switch doctors. And of course, this can get very complicated. So when figuring out which doctors in network or out of network, and this is where it can really help to work with an independent advisor. So that was Ronald's situation. What about Linda's situation? Well, Linda is a little bit different. She's not as worried about premiums, but she really wants to be able to see any doctor who accepts Medicare without a referral. And because she can afford to pay a bit more in premium than Ronald, she decided to choose a Medigap plan. Here's what you should know about a Medigap plan. First, if you have a Medigap plan, you can see any doctor who accepts traditional Medicare, full stop. You're not limited by any carrier's network. So if the most important factor to you is choice of doctor, then I would definitely suggest thinking carefully about a Medicare supplement plan because that will afford you the most choice generally. The second thing you should know about Medicare supplement is that there are only certain points in time you can sign up for a Medigap plan. And when I say Medigap and Medicare supplement, they refer to the same thing, but I know it can get a little confusing. So for the rest of the presentation, I'm just going to refer to it as Medigap. So the thing about a Medigap plan that you need to know is that there's a guaranteed issue window, and I'll come back to that in a moment because that can get very complicated and it varies by state. The third thing is that Medigap plans are more expensive than Medicare Advantage because you pay a premium to your Medigap insurance carrier to cover that additional 20% that your Medigap plan sits on top of. In addition, we typically advise our clients to also consider standalone prescription drug coverage because a Medigap plan doesn't cover your prescription. And finally, I know I sound like a broken record, but you can't have both a Medigap and a Medicare Advantage plan. It's one or the other. There needs to be a choice. Now, I promised I'd come back to talk about guaranteed issue rights under Medigap plans. So here's what you should know about the guaranteed issue window that comes with a Medigap plan. First, what is guaranteed issue? What do I mean by that? What I mean is that an insurance carrier first, they have to sell you a Medigap plan. Second, they must cover all your pre-existing conditions. So even if you're diabetic or you have some type of chronic condition, then it doesn't matter. You still have to be offered the same price as someone who has no pre-existing conditions. They can't charge you a different premium as a result. And then finally, they can't profile you. So these are all the benefits that come with a guaranteed issue right. And that's why it's so important to act on your guaranteed issue window. And again, it varies by state. So for example, if you live in California, you have an initial guaranteed issue right by law for the 6 months after you start your Part B. And the thing is, you're only entitled in California, for example, to one guaranteed issue window, whereas in a state like New York, you're always operating under the guaranteed issue window. So depending on what state you live in, your guaranteed issue rights are different. And that's another reason it's important, if you're watching from home, to work with an advisor so that you don't miss your guaranteed issue window. Because you don't want to go through medical underwriting. It gets really messy when carriers are able to ask questions about what medications you're on, when's the last time you've gone to the hospital, and what doctors you're seeing. Now, you'll note on Medigap plans, I haven't said anything about prescription drug coverage yet. And the reason is because it's not included. So for Linda wanted drug coverage when she purchased her Medigap plan. So we actually advised Linda to choose a standalone prescription drug plan to make sure that her medications would be covered in addition to her medical costs. Now, here's the thing about prescription drug plans. First, they cover your prescriptions. Now, it's sometimes paid, it's paid for partially by the government, but it's also paid for partly by you. The premiums can vary from anywhere from $7 to as much as, I've seen premiums as high as $100. And these are per month premiums. And the reason you should get it is that it's not required, but we highly recommend it. And here's why. If you sign up too late, there are late enrollment penalties. So as I mentioned with Linda, even though she had that eight-month special enrollment period, if she went without drug coverage for 63 days, then the penalty for late enrollment for her drug coverage actually would have kicked in after only 63 days. So this is why it's very important to get a head start as soon as you start thinking about retirement, if you're going to be reliant on your Medicare benefits to cover your health insurance once you leave your employer. The other thing about standalone, Part D coverage is that there are two ways to get it. The first way to get it is by purchasing the standalone plan like Linda did. And the other way is, as Ronald did, through a Medicare Advantage plan. We typically see that prescription drug coverage and we typically only recommend plans that have the Medicare Advantage plans that have prescription drug coverage wrapped in, because we find that that's typically very important to our clients to have drug coverage. So as we just discussed, Linda and Ronald made different choices. Linda chose a Medigap plan. Ronald chose a Medicare Advantage plan. So I just want to take a minute and recap the different plans for you. Here's what you need to remember about a Medigap plan. Medigap plans have higher premiums than Advantage plans, but they typically lower your out-of-pocket costs in the forms of copays or deductibles when you get sick or go to the hospital. The third thing you should know about Medigap is that you can see any doctor who accepts traditional Medicare. You also typically see clients that choose a Medigap plan also buy standalone drug coverage. And finally, Medigap typically doesn't include supplemental benefits that you might otherwise get, things like seeing a chiropractor or over-the-counter benefits. Those are things that are typically in Medicare Advantage and not offered through Medigap plans. By contrast, Medicare Advantage plans have lower premiums than Medigap plans, but they have higher out-of-pocket costs since they have a predefined network through the carrier. So you need to know that when you see a doctor or when you go to the hospital, you'll typically have a copay associated with your Medicare Advantage plan. So even though it's a $0 monthly premium with many plans, you'll see that there are high out-of-pocket costs from using the Medicare Advantage when you need care. And then again, Medicare Advantage plans typically have Part D drug coverage. Now, some people stop their Medicare journey here after stage 2 because they know the deadlines for signing up for Part A and Part B. They've made a decision that they either want to go the Medigap route or the Medicare Advantage route, but that's not the end of your journey. And you don't have to go through which plan type specifically to choose. That's really where it can benefit you to work with an independent advisor. You want to make sure that you're working with someone that can offer you both types of plans, Medigap, Medicare Advantage, but also within those types that they can offer you any insurance carrier that is offering a plan, because these options vary. They're very specific down to the zip code. And that's why you want to be working with an independent advisor that can guide you through how the options might vary depending on where you live. So an example I have, and I wish you could see this right now, is I just pulled up all the plan information for Miami-Dade. And what we see in Miami-Dade is that there are 357 options for a Medigap coverage in Miami-Dade, which is just an unfathomable amount, since there are only 10 types of coverage within each 10 types of Medigap plans offered. And what we also see is that there are 59 options available for Medicare Advantage. So put together, that's over 400 options for you to wade through. And again, this is really where it can pay to work with an advisor, because all these plans have different premiums and they vary based on other factors too, like the benefits that they offer, the deductibles and copays that each of the plans have, and your out-of-pocket maximums. And of course, they also vary if you're in Medicare Advantage, looking at Medicare Advantage, along the physician networks and which doctors are covered. So here are the factors we find that it's important for our clients to consider as they go through deciding which particular plan to choose. The first thing that we notice is cost. The second is the doctors and networks that you want to be a part of, the hospitals that you like to go to, and also the specialists that you see. The third is the type of medications that you're on. And then the final consideration is whether you're moving, whether you like to travel. Things are opening up soon as the vaccine is being rolled out, and what your lifestyle preferences are. So these are all things that it's important to talk with an advisor through, because it can really weigh on which type of decision you're going to make. With a Medigap plan, for example, you're able to see any doctor across the United States. So even if you purchase a Medigap plan in Florida, for example, let's say you're vacationing in Hawaii, you can actually see a specialist in Hawaii if you prefer. But if you're on a Medicare Advantage plan and traveling, you're going to be severely constrained by your carrier's network. It's unlikely that you would be able to see a doctor if you're out of network, unless it's an emergency situation. I just want to emphasize, I know I stressed this at the beginning, that we're noticing that for 2021, there have been lots of changes in coverage. What we've noticed specifically that's changed is that the premiums and costs of each plan have changed, The benefits offered by plans have changed, and the physician networks within the plan have changed. Some clients have found that doctors that they'd been seeing in 2020 aren't going to be covered in 2021 as a result of a doctor change, in which case, oftentimes I'll find them a plan, and our team will work together to find a plan for that client that will cover the doctor that they'd been seeing previously, but won't be covered under the plan that they had been using. So this is why it's important to reconfirm coverage every year. And starting January 1st, if you already have a Medicare Advantage plan, then you're going to have some flexibility to change during Medicare Advantage open enrollment, which is January 1st to March 31st. And this is really, again, if I want to stress one thing, one takeaway, it's that this is why it's so important to reconfirm your coverage. And it's not too late if you haven't done it. Yes, the commercials about the annual enrollment period have ended, but there's still opportunities to confirm that you're on the right coverage, even if you're not using the annual enrollment period. And I can cover those at the end when I summarize. So now I wanted to talk about the top 5 Medicare misconceptions that I see so that I can help you avoid them along the way. I don't want you to make these mistakes that we've seen our clients make. And I will summarize these. So if you're just jotting these down, don't worry, there'll be an opportunity at the end to go over them one by one. The first misconception we see is that traditional Medicare covers all medical costs. You know that's not true. It only covers 80% of your medical costs, but then there are a whole host of costs that it doesn't cover at all. That's why a lot of clients consider plans with supplemental benefits, because those are things that original Medicare doesn't touch. The second misconception is that your Medicare starts as soon as you turn 65. We saw this in Linda's case. Linda is 67, but she was coming off her work health coverage, and therefore she hadn't started her Part B yet. So Linda needed to affirmatively opt into her Part B. And a lot of this is something that all our clients need to do, actually, is they need to opt into starting their Part B in order to make sure that their Medicare is going to start when they anticipate. The third misconception is that it doesn't matter when you sign up for Medicare. By now, you know that this isn't true because I've mentioned the penalties. In fact, there are 2 in particular for late enrollment. The first and the most onerous is the Part B penalty. What the Part B penalty is a 10% penalty on top of your Part B premium for every full year that you wait to sign up. Then there's also a Part D, which is the prescription benefit. There's a Part D prescription penalty of 1% of the average Part D premium for every month you wait after the end of your initial enrollment window. So if you look at Part B eligibility, for example, if you were eligible as of January 1st, 2020, but you waited a full year to start your Part B, you're going to owe a 10% lifetime penalty. that's the worst part, is that these are lifetime penalties and there's nothing that can really be done about taking them back. So the fine is going to be owed for every month, and it's just added on top of your Part B premium or your Part D premium. Now, you might be watching this presentation and say, I didn't opt in to my Part B. I just put it off, or I didn't remember, I didn't know, and that's okay. The important thing is to stop the bleeding, because the longer you wait, the bigger that number is going to get. And so that's why, if you're listening right now and you think you might owe a penalty for Part B or Part D, then I really want to speak to you after the presentation to see what we can do about preventing those penalties from getting any larger. The fourth misconception is that your neighbor's Medicare coverage is a good plan for you. I hear this all the time. And here's the thing. There are specific individual factors to consider when choosing a plan. And if your neighbor's individual factors are the same as yours, then perhaps your neighbor's plan is one that you should consider. But if you're different than your neighbor in these respects, then their plan really might not be the best option for you. And again, these options are price sensitivity. How important is cost to you? If cost is the number one factor, then perhaps a Medicare Advantage plan is the route that you should go. But instead, if seeing the doctors that you've previously been seeing is most important to you, then you're going to perhaps want a plan, a type of plan that would offer more choice, and that would be a Medigap plan. The third factor to consider is prescription drug coverage, whether you need whether you want it placed into your plan as it would be with a Medicare Advantage, or whether you're comfortable paying another premium to have standalone prescription drug coverage. And then the final factor is location and lifestyle preferences. Again, likely that your individual preferences are different than your neighbor's. And so therefore, your neighbor has a different decision to make than you do. Although definitely happy to take a look at your neighbor's plan too. And maybe they're on the right plan, or maybe your neighbor should consider switching too, in which case I'd be happy to speak to your neighbor and walk them through why they chose the plan that they did. The final misconception is that you only need to choose additional Medicare coverage once. By now, you know I sound like a broken record, because you need to reconfirm your Medicare coverage every single year. And we call this a Medicare checkup. And it's important because what's changing every year are the premiums and costs, the benefits, and the physician networks. So that's why it's important to speak to an advisor that can look through your plan and figure out whether it's the best plan for you based on your individual factors. And as I mentioned, coming up, if you have a Medicare Advantage plan, is the Medicare Advantage open enrollment period, which extends January 1st to March 31st. And even if you feel that you're on the right plan, it still doesn't hurt to have a second opinion. And so that could really be an opportunity to work with an independent advisor to figure out what will be the best option for you, even if you can't make a switch. What are things about your plan that you might be able to optimize, or things that you didn't know about that are part of your plan that you can start using for the upcoming year? To summarize, the first misconception we see is that traditional Medicare covers all medical costs. You know it doesn't. The second misconception we see is that it's automatic. You know that it's instead you need to opt in to your Medicare. The third misconception we see is that it doesn't matter when you sign up. You know that you want to avoid late enrollment penalties. So it really matters. This is something that is very important to be on top of. And I know that just by virtue of attending this presentation, it's something that you're aware of. And it's a part of your retirement planning that you're taking charge of. And so that's very exciting. And fourth, your neighbor's plan may or may not be a good plan for you. Again, it depends on your individual factors. But just because your neighbor selected it, it doesn't mean that it's the right choice for you. So that's the fourth misconception we see. And then finally, the last misconception is that you only need to choose additional coverage once. It's something that you need to reconfirm every single year, because the plan is changing every year. All right. So in conclusion, I would really love to stay in touch with you. I hope that you learned from today's presentation how to take control of your retirement planning around your Medicare. It's a huge part of enjoying your retirement. And with that, I've left you with my email address, which is ari@getchapter.com, ARI at getchapter.com, and my phone number, which is 605-205-8869. And with that, I'm open to questions. All right. So first question I'm seeing is just about summarizing the different enrollment opportunities, the different initial enrollment windows. So I just want you to keep in mind that there are actually four, and it depends on your plan type as well. The first is the initial enrollment period, which I broke down as it applied to Ronald. That's the 7-month period that starts 3 months before the month in which your birthday takes place and extends 3 months after the month in which your birthday takes place. So it's 7 months in total. That's the initial enrollment period. Then the other period I talked about is a special enrollment period, which is the 8 months you have after you leave your work health coverage to choose just to start your Medicare Part B and also to sign up for additional coverage if you prefer. So that's the second type of window that you can use. I'm also seeing, I'm seeing another question. This actually dovetails very nicely. I'm seeing a question is that someone thought the deadline is December 7th. That was the deadline for the annual enrollment period. That's why you were seeing so many commercials and maybe getting some direct mailers. And the annual enrollment period did end last Monday, but there's actually another enrollment period coming up January 1st, which is Medicare Advantage open enrollment period. And what Medicare Advantage open enrollment period affords you is if you chose a Medicare Advantage plan during the annual enrollment period, then you can actually switch that plan during Medicare Advantage open enrollment period. Or if you already were on a Medicare Advantage plan and you didn't use the annual enrollment period, then you can still use that window to choose a different plan for 2021. Now, a couple of things to remember here. The first is you must already have a Medicare Advantage plan. So if you are looking to get a Medicare Advantage plan, sadly, this isn't the opportunity for you to do so. And the second thing is the plan that you select will start the next month after the window. So if you make a switch under open enrollment period in January, your plan won't take force until February 1st. And that's true during each month of the open enrollment period. So these are two distinct periods that we're talking about. The annual enrollment period, which is ended, and the Medicare Advantage open enrollment period, which hasn't started yet. That's yet to begin. All right. Other questions that come to mind. Can I use the Medicare Advantage open enrollment period if I have a Medigap plan? Great question. Sadly, no. You cannot switch from a Medigap plan to a Medicare Advantage plan during the open enrollment period that starts January 1st. You can disenroll from a Medigap plan, but then you would just have Medicare Advantage. You would just have original Medicare. Now there are some exceptions to this window, and they're very important exceptions. Normally, they apply if you've just started your Medigap plan, and vice versa. If you just started a Medicare Advantage plan but decide that you'd like to go to a Medigap plan, then you typically have a year-long window. And if that applies to you, I definitely encourage you to reach out because those rules also vary by state. All right, seeing another. Oh, wow, these are great questions. I'm seeing a question about the Part B premium that's owed. This question is about someone who files jointly with her husband and makes about $130,000, but in joint. And the question is whether they each owe a Part B premium or whether they just owe one. Even though you file your taxes jointly, each of you will owe a Part B premium. And because you file less than, I think it's $170 something thousand jointly, you will actually only owe $148.50 each as your Part B IRMA for 2021. But I can send out a list after the presentation of how the IRMA varies based on income. Seeing other questions here about travel coverage. The question as it pertains to travel coverage is what type of additional coverage someone should purchase if they love to travel internationally. I also love to travel internationally, so this question really speaks to me. I would, when clients prefer to travel and they want medical coverage when they travel, I typically suggest looking at Medigap plans, because some types of Medigap actually cover 80% of your international travel for the first 60 days that you're outside the United States. Now, this has to be a medically necessary. It has to be whatever you do when you're abroad must be medically necessary, and it must be an emergency. But if those two conditions are satisfied, then through some Medigap plan types, you can actually achieve 80% coverage. On top of this, you may also want to consider supplemental travel insurance, of course. And if you have a Medicare Advantage plan and are traveling internationally, then you definitely want to purchase supplemental travel insurance, as it can get very pricey to have care abroad. And there's very few Medicare Advantage plans that cover international travel. But if you have a question about how your Medicare Advantage plan might cover your international travel, reach out to me. My team and I would love to discuss where you're going, and also what type of care you anticipate needing when abroad, or that is top of mind for you. All right, I'm seeing another question on, okay. So I'm seeing a question about Medigap Plan F, as in Frank. And the question pertains to switching from a Plan F to a Plan G, as in George, and what's the difference? Well, Plan G and a Plan F are the very same, except that with a Plan G, you owe an annual Part B deductible, which in 2021 is $203. So the way it works is if you switch from a Plan F to a Plan G, the first $203 of your Plan G will be forwarded to you. And then after that deductible is met, every penny thereafter of your medical costs will be forwarded on to your insurer and paid 100%. So you won't see a bill after the first $203 in deductible. Great question. And we have been seeing a lot of clients switch from a Plan F, as in Frank, to a Plan G because of the premium savings between the two. And so if you're on a Plan F, definitely reach out after the presentation, because you're likely paying too much for what you have now, and you might want to consider moving to a Plan G, since it does the same thing except for the annual Part B deductible. All right. Well, it has been a joy to be with you for the past hour. I apologize for the technical difficulties at the beginning, but we made it through, and I hope to hear from you. My team and I are really looking forward to speaking with you. Just reach out, drop us a line, say hello. My email again is ari@getchapter.com, ari@getchapter.com. And my number is 605-205-8869. And I'm looking forward to hearing from you. Bye-bye.